your question, and here is this timer has started.
Okay.
Right, so if you have read and understood, considering it communication skills station, kindly please begin.
Yes. Hello, I'm the SHO working for Mr. X. I'm calling to ask to speak to Mr. X. I'm asking him about an advice about a patient who has gone right hemicolectomy for a cecal cancer one day before, and now the patient is oliguric. Could I confirm that I'm speaking to Mr. X?
Yes, can you summarize your case, please?
Yes, Mr. This is a lady, 69 years old. 69 years old. She has been operated upon yesterday for right hemicolectomy for a cecal cancer. The problem now is that the patient is oliguric. We only got about 10 to 20 milli of urine in the last 8 hours, and for which I checked the catheter, and it was not blocked. By examination, the patient is tachycardic, hypotensive, and also she has mild fever, and but her abdomen is lax. I have withdrawn some bloods, which showed hemoglobin has dropped from 12 to 10. And urea and the creat are moderately elevated, and also the patient has taken 2 units of blood. So I want an advice about this patient, please.
What do you think might be the cause?
I think the cause might be the patient might be dehydrated because she only received 1,100 milli of normal saline in the post-operative day 1. The patient also there was also a loss of blood, but she had taken 2 units of blood.
Do you think patient is bleeding actively? Right now?
Maybe there is a bleeding, but I will start a resuscitation for the patient, and I will do serial abdominal examination together with abdominal ultrasound, and I will know if there is a bleeding. I might know, and also I will draw some bloods after this to check the hemoglobin.
How are you going to give the fluid challenge to this patient?
Okay, I will start by giving her 1 liter of crystalloid over 1 hour, and then I will check. I will check for the vitals and do serial abdominal examination, and if there is no response for the fluid challenge, I may transfer the patient to the HDU for insertion of central venous catheter, and also I will reserve for her units of blood in case I need it in case of non-responsiveness to the fluid challenges.
Do you think patient is having an anastomotic leak?
I think it's not an anastomotic leak because on examination of the abdomen of the patient, her abdomen was lax and there was no signs of peritonitis. But I will continue to check in the ward for serial abdominal examination, and also I will order an abdominal ultrasound for her for knowing if there is a peritonitis or not.
Do you think do you need me to come back and see the patient?
I think I will start the fluid challenge right now, and I will update you with the results.
Yes. And more?
And when I when I know the result of the fluid challenge and the fluid balance
Yes.
for
And
him, I will update you with the news.
okay. What if the patient's saturation drops, and I want you to tell me all those things as well, please.
Okay.
If there's worsening of, yes, blood labs, and then what would you suspect? And
Yes, if the patient has become toxic, or has become rigid abdomen, or has decreased in blood pressure, or has a decrease in the oxygen saturation, I might call the ITU and registrar, and I can transfer her to the HDU, and I will call you, and I will start a crash call, and I will call you immediately.
do you think patient requires immediate operation or expiration?
I think no, it's not requiring an immediate operation, because the patient is not toxic, and she has no acute abdomen and no signs of peritonitis. So there we have to wait and start resuscitation for the patient, and we will see the response, because it might be only a dehydration. So dehydration will not need an immediate intervention.
What might be the cause of shock in this patient?
It might be an hypovolemic shock, because the patient had an operation, and she lost blood, and she only received a few liters of saline post-operatively.
Okay. What would be your final plan of action for the management of this patient?
Yes, my final plan of the action. I might consider this patient a critically ill, and I will follow CRIS protocol at anywhere. I will check for the airway. If the airway is patent and patient is speaking to me, I will start to assess the breathing by looking for the trachea, and looking for the respiratory movement, and for which I will assess also the pulse oximeter for oxygen saturation, and whenever the patient will need oxygen, I will administer high flow oxygen, and also I will assess the circulation using the mental status and the color of the skin, capillary refill time. I might need urinary catheter if I want. I will insert it, and might need ECG if the patient will transmit it to the HDU for assessment of the fluid challenge. And for which I will start my resuscitation plan. And also I need to expose the patient, and the patient dressing for any site for any signs of leakage or blood, or any signs of toxicity. And also I will check for the patient lower limb for any signs of lower limb DVT. And also I have to check the mental status of the patient with disability. I can use the Glasgow Coma Scale, or the focal assessment, neurological assessment of AVBU. The patient will be alert, or respond to voice, or to pain, or unresponsive, for which I will start my management.
Very good. Okay, you carry on with this management plan that you have just told me, and if you need me to come over, then do let me know. I'll come over to see the patient. Okay.
Yes, sure.
Okay, good. Thank you.
Thank you.
Very good. All right. Well went. Excellent. In this plan of management, when you were telling me about the lower limb
Yes.
DVT plan, that was when I wanted you to tell me that if also the hemoglobin during surgery, it was done and it was found out to be dropped from 12 to 10, and patient was given 2 units of blood. So when I asked you to add more, I wanted you to tell me that you'll repeat the blood labs as well to see if there is blood loss has recovered, or there has been any further loss of blood. Also, if you suspect DVT, then you will give heparin and TED stalking. So
Yes.
at that time, but then you covered when I asked you about the plan of action. So yes.
Okay, but there was a question. If you want me to come back, I told you that I will start the fluid change and I will update you.
Yes,
You want me to
exactly. Yes, that's exactly what the answer should have been. And you yourself told me when you'll require the patient to be transferred to HDU. And you don't think the patient needs immediate surgery or exploration right now. So these are the all correct answers that you have answered.
Okay,
Good.
okay.
And if patient fails to respond to fluid challenge, okay, then you'll ask. And even the labs, if they have become worse, I told you, that was what I was expecting to hear.
Yes.
Yes, because they can ask you, and you have to be careful when the labs were done. See, so they'll ask you the date when the labs were done last. Then you would have to, like in the preparatory bay, make sure you notice when the labs were done, exact the date. If you can't remember, then you can say, okay, I'll confirm and then get back to you, instead of giving any wrong figures.
Okay.
Good. Thank you.